Irreverent, entertaining, cool. You're listening to LA Talk Radio.
You're listening to Remotely Unique with Mary Baca, only on LA Talk Radio.
Hi, this is Mary Baca coming to you live from Albuquerque, New Mexico today. Thank you everyone for who's listening in at this time. We're concluding our series today on From Fear to Freedom series that we did in April. And let me just tell you a little bit about myself before we get started, for those of you that are tuning in for the first time. Again, my name is Mary Baca, and I have two businesses in Albuquerque, New Mexico. One of them is called Odyssey Counseling Services, and the second is called Resilience Integrative Services. I've had Odyssey Counseling for going on 26 years. It's been a long time. I can't believe how fast time has gone. It's a psychotherapy practice. And then my second business, Resilience Integrative, is a holistic services practice. In addition to being a licensed psychotherapist, I am also a certified applied kinesiologist, certified Reiki practitioner, certified EMDR professional, and I'll talk a little bit about that later, and then also certified hypnotherapist most recently. In addition to having my practice for 26 plus years, I at times have worked full-time for other businesses. For example, I've done child abuse investigations for the state of New Mexico. I was a full-time employee assistance counselor for the United States Postal Service. I've been milieu director and director for different treatment programs and adolescent treatment centers and other workplaces. I've taught in local colleges. And I do a lot of my work not only locally, but even remotely, hence the name Remotely Unique. I chose to talk about fear and to do this series because I really feel like fear is a big issue for people presenting with mental health issues. And like we've talked about in other shows, it is on a continuum. Some people have severe states of fear which present as panic, and then other people have normal amounts of fear responses to certain things that are going on. When I get people that come into the office, sometimes what's happened is that there gets a condition, we call it conditioning in the psychology world, where something that's occurring simultaneously, two or more things occurring simultaneously, result with our mind associating them with each other. So, for example, such as is in the case of PTSD, post-traumatic stress disorder, you can have somebody who goes through a traumatic event, and their mind at that point then starts to associate things that they've taken in with their senses, so smells, sights, things they've heard, with danger or pain or things like that. So what happens is then the mind in the future, those things become a trigger. So the mind in the future begins to associate, like, say, the sound of a car wrecking, begins to associate that sound with fear and anxiety and the whole fight or flight thing, the need to either stay or go physically. Some of the more probably common things that I think everybody can relate to that are fear-based is like even the fear of abandonment. So sometimes you'll see people really hold on to a relationship and struggle with letting it go because they are afraid to be alone. And the thing with fear is if it's a fleeting thing, if it's just something that's in transition and it's short-lived, then just like anything else, that's not really when there's a problem, right? It becomes a problem when the person is unable to go through the process that they need to go through and get past it. And it's really important to seek help at that point so that those patterns don't just get reinforced over and over and over for years. So, like, for example, sometimes I'll get somebody who comes in with a fear of driving. And when I ask them how long they've been battling with that, it can be years. So the sooner that a person gets help, the better. And believe it or not, one of the other things that I see commonly that goes on with people is a fear of things going well, which is interesting. That may sound to you listeners like, well, how could that be? We all want our lives to go well. But again, that association thing, the person might have, as a child even, experienced things going well and then them falling apart. And so there becomes this mental conditioning and association with, being afraid to enjoy the good because for fear that other shoe's going to drop. And I can't tell you how much I see people with that issue. And the important thing with counseling is, people are not going to necessarily bring that up. I mean, it takes I think a skilled clinician to really know exactly what to ask for and kind of where to look. And I know a lot of times I've heard people say, well, what do you do anyways? You just listen to people. But really, in fact, yes, we do. We do listen to people. But the fact is that our mind is working the whole time we're listening to people because we're plugging in, whether it's theoretical approaches that we have or whether it's thoughts that are going on about what the person is saying. But, a counselor's mind is very active during the process in order to help the person that's receiving help. One of the other fear state conditions I've seen people for is like performance anxiety. And a lot of times what's attached to that is a fear of failure, of course, but even a fear of success. Because if you think about it, when people are successful, well, then what happens? That means that the people in their life and even themselves are going to expect that from them all the time, right? So sometimes people who are having a fear of failure, they also kind of underneath are having a fear of succeeding, as strange as that sounds. One of the important things about fear is that people will respond behaviorally to a fear condition. So, we're going to talk today. I have two guests with me. They are both therapists that work for me in my agency. And we're going to talk about how one of the byproducts of any fear condition is control. Behavior that is controlling. So for the driver that has a phobia of driving that I described earlier, that person may control their fear state by not getting in a car and refusing to drive, for example. But let me go ahead and bring on Evangeline Gonzalez. She is one of the therapists that works for me. Welcome to the show, Evangeline.
Hi, thank you for having me.
And the other therapist that works for me is Tom Henderson. You've heard him before also because he is a first responder and now is a counselor full-time. Welcome to the show, Tom.
Hello. Thank you for having me again.
So each of you talk a little bit about who you are and what your background is as far as just who you are, your professional background and dealing with fear and people who have been in fear states or fear conditions of fear. Tom, you want to go ahead and start?
Okay. I guess one of the common fears that I've been seeing a lot is there's a lot of people I've dealt with that have been fearful of just kind of leaving home. And with the what they view as society today and the threats to just themselves and the home when they leave. And it's been working with them to identify the factors that they, what they've seen, what they've heard, what they've been through, to identify where this fear of, the outside world, for lack of a better word, is going on. And try to go back to the root of it all and identify the foundations and the ground level for where this fear began. And for a lot of them, it could have been an event that happened years ago that just keeps bubbling and getting worse and worse as time goes on because they didn't get any help or any assistance when they first started going through it. And it's evolves into PTSD and severe anxiety disorders because they haven't had the ability to deal with the fear they have. And a lot of people, like you said, will be fear of success or fear of failure, but they don't realize that there is help and this stuff can grow and get worse if they don't seek the treatment they need right away. Or as soon as they start realizing it, they think they can just get through it and it won't be a problem. But as soon as they start realizing, okay, I try to get them to understand where the foundation was for the fear and try to identify causes and irrationalities around it and how to build from that.
Right. You know what? And you mentioned something that's so important that I think we all forget is I think there are a lot of people that don't really talk about it, but do think twice and have some fear about leaving home. Like, and I think part of it is because of all the things that are going on in our world. I mean, even like, these shootings that take place in schools. I mean, we don't live in the society that we lived in, even like 10 years ago. So I think there are some newly arising fears that happen for people, even on that level, like just being afraid to, send your child to school, not to the point where you don't, but to the point where you at least think about it. Whereas in years past, that didn't need to be a thought,
Exactly. There's a lot of people that, they see the media, they see the news, and they feed off that, and they have that as the view of what the real world is like and out there. And, you have to bring them back to reality, show them, yes, shootings do occur, yes, car accidents do occur, but then, get them to start realizing, what small percentages of that actually occur and what small likelihood it is for them to be involved and how such a severe fear is affecting their greater life and their social life and work and everything else that it encompasses and how controlling it becomes.
Right, it does. It really can take control of your life, really, in the most extreme cases, for sure. Evangeline, what about you?
Well, I see a lot of generalized anxiety, just worrying about, everything, nothing in particular that really is the focus, just kind of worrying about everything in general. But I see a lot of emotional reasoning. They feel like this is the way it is. Whatever they're worried about, they just assume, nope, this is the way I feel, therefore this is the way it is. And so I think showing them that, using cognitive behavioral techniques to show them that, this is the way you're feeling or this is the way you're perceiving the situation, it doesn't necessarily mean this is the way things actually are. So like what Tom was saying, you have a real fear, and of course sending your kids to school can be scary because there are shootings that happen. Stuff happens every day, but there is a small percentage. This isn't happening, all the time. This doesn't happen to everybody. Everybody doesn't experience this stuff, and so I think just showing them that this is your fear doesn't necessarily mean that it is true and that it is rational all the time.
Well, and you mentioned cognitive behavioral therapy. So for our listeners that don't know what that is, Tom and Evangeline, can you talk some about that, about what that is and how you work with your clients using that approach? Okay.
Cognitive behavioral therapy, that's a good therapy for fear, for anxiety. When you're using that, you're identifying, challenging, and changing the beliefs that are causing someone to experience that anxiety. So, someone has a thought, and, like your thought is what's going to make you feel something, and then you're going to behave a certain way. So if you can change someone's thoughts, you can help them kind of correct those negative thought patterns. You're going to change the way they believe and change the way they behave.
Well, and I think one of the things, too, with cognitive behavioral therapy is it gives both the client and the clinician a chance to look at the irrational thinking that can be going on, because sometimes that's the first time the person has verbalized any of that to anyone.
Right.
And so you can start to get an idea, kind of sort out, what's going on that's rational and what's going on that's irrational. What would you add to
Right.
that, Tom?
Well, I think exactly what you guys are saying about the CBT and everything, and it's all about, from what I like, is going back to the event and identifying the effects around what occurred, and then going through how their thoughts evolved from it, their feelings, and the fear and actions that came after it. But I like to identify, what was going around the original initial event that caused the fear to be instilled on them, and what get them to identify the event and what, if it's possible, and find out, identify, this was just a, maybe flash in the pan event, or, this what happened here. A lot of times there's a lot of guilt going along with it as well that you have to deal with, because they're fearful that they should have done something different. They have fears based off of different, their emotions coming off that event. And, for some people, it's based off the guilt that they should have done something different or could have done something different to prevent it, and it builds from there.
You know what? That's an excellent point. And I think that with that, when you go back to the originating event, you get to kind of look at, well, what about that event is where the person is getting stuck in the fear? So it might be the guilt, that emotion that just kind of keeps replaying. It might be, some other aspect of it. But by going back to the event, you're able to kind of take that apart even more and look at that. Because otherwise, for example, I'll give an example of a guy, and we're going to talk about EMDR today just because it's phenomenal, and every chance I get, I talk about EMDR. But years ago, when I did work for the Postal Service EAP, I had a guy that came in, and he had been robbed at knife point. And so, if you looked at that, you would just make all kinds of assumptions, right, about why that would have been an anxiety / fear provoking situation for this gentleman. But through doing EMDR, it became apparent that where he was hung up, what was distressful to him, because the guy after that incident, he couldn't go back to work. But where he was hung up was thinking that in his younger days, he would have jumped over the counter and overpowered the guy with the knife. And so he wasn't, fearful of that this guy pulled a knife out. He had a fear of getting older, and felt that, that as he got older, his body was deteriorating and, that he was no longer going to be able to protect himself in the same way, and that kind of thing. So really getting into taking that event apart was really helpful and important in figuring out where he was stuck. Do you guys have any examples like that? Not like that necessarily, but of people that you've been, that you've worked on fear conditions with.
I'm trying to think of one.
Well, I have one, I guess, that is still current and everything. He's very fearful of leaving home. And it goes back to an initiating event years ago when this house was broken into. And it has, you discuss every issue, where break-ins are, how the different things done to improve the security of his new home. There's even an older home that was years ago, and he's discussing all the issues there. But it's that he has a great deal of guilt because it's his job to lock up, his job to make sure everything was done at the home when he left, and when they came back in there. They didn't have a lot of items stolen. They didn't have a lot of things gone. I think maybe, if you like the TV or something else was taken, but the violation and the thoughts of, what could have done to do it, and feelings of fear and despair, and started building from there over years. And that initiating event, and he still feels guilt over it being his fault. And that trigger has created a great deal of anxiety and fear in him, to the point that it's almost being debilitating to him now.
Right, so he's kind of stuck in his fear. He's stuck in his state.
Exactly.
Yeah. That can be really debilitating for sure.
And it's
I-
Go ahead.
sorry, go ahead. No, it's gotten to the point where he's fearful to leave home at all. It's affected his work career to the point where he's not working regularly anymore, and his relationship with his wife and family as well. So it's created a huge difficulty in his life that he's trying to work through and trying to improve, but he's still latches on to that initiating trigger event.
It's like a domino effect.
Yeah.
It sounds like, yeah. What were you going to say, Evangeline?
Oh, I was going to say, I'm seeing a client who has a fear of the afterlife, and she's pretty preoccupied with it, and so we've been working on that. And after doing some EMDR, which I know we're going to get into in a while, we were able to figure out where it started. Was when I went over to try to get to the root of it, find out where this fear came from. She wasn't sure. She couldn't come up with anything. And then after doing some EMDR, we found out that it's a fear of the afterlife, but more so it's a fear of losing her family. And then how it started was, waking up one morning and parents were gone, couldn't find them. And it was extremely traumatic for her. It was very scary. And so now she's really underneath it all. She's just so terrified of losing her family. And so, she feels like she would just be devastated without her family, and they would be devastated without her. So she also assumes that they have that same fear. Again, she feels like, okay, this is the way I feel, so everyone must feel the same way. EMDR has been incredibly helpful for her.
Yeah, it's amazing. One of the things, and you just described it, is with EMDR is it kind of freeze frames the different process a person goes through, like that brings them from like a normal state, to one that is potentially anxious and fearful. And, without EMDR, it might have taken a long, long time to figure out what her fear was about. The thing too about anxiety and fear is that, and going back to something Tom said, is that it is so important to catch it like anything else in life, right? Like our health or anything, to catch it as soon as we know there's a problem, and even better yet, to be preventive. Because like with anxiety, what happens is if a person develops anxiety as a child and maybe it goes unrecognized, then that condition just stays there, and it's almost like a magnet that it just kind of picks up things along the way, that become issues and that become things that person becomes afraid of as they grow into their adult years. So, so like with that example that you're talking about, Evangeline, like who knows even how far back that goes, because when you think about it, when you think about somebody waking up and their family's not in the home, okay, that would be pretty freaky. Of course, that would be terrifying, actually, right? And but it's like I'd be interested to know if there was more, if there was a level of anxiety before that happened, because what typically happens is then the anxiety just grows, or it really just amplifies an anxious condition that was already there.
Right.
And that's so interesting. The other thing about fear is, what's fearful to you and Tom and me might all be different. So,
Right.
that's kind of interesting too. It's like it's not a one size fits all for sure.
Right.
Right, exactly. Like my experience as a first responder, I have different fears than someone who hasn't been a first responder, who has different life experiences, and they're completely different on different levels.
Right. And that's interesting too, because sometimes, it's hard sometimes for people to talk about these things, because people will be like, well, why are you afraid to drive? Like, I don't understand. And, sometimes people, of course, because it's hard to deal with, right? Somebody who can't drive. Sometimes loved ones and family members or friends are not very patient about those kinds of things. And so that, can then just make it even worse. Another example that I had that was interesting with doing EMDR with a gal, this is many years ago. she was afraid, she had anxiety and fear of holding a baby, of anything having to do with children. And in doing her assessment, because that's always probably, one of the most important first things we do, right, is a good assessment. But she had had an abortion. And so she thought, and walking in, that's what the assessment showed, was like, okay, that makes sense. She hasn't worked through that, and that's why she has a hard time with holding children or being around babies, right? Well, when we did EMDR, which, by the way, stands for eye movement desensitization reprocessing, and I'll explain in a little bit what that is. Evangeline and I can talk about what that is. But anyway, so we did one EMDR session, and in that session, she remembered that she had been sexually abused as a child, and that subconsciously, in fact, why she ended up having that abortion was because she felt she would not be able to protect her baby. And she was so fearful of her baby, her unborn baby, getting sexually abused that she had an abortion. And so in that one EMDR session, she was able to realize that. That information came from the subconscious to the conscious. She was able to realize it. And then she was actually able to forgive herself. And this was, say, we did EMDR on a Wednesday, and that Saturday, she went to a baby shower and was able to hold a baby for the first time in years. Hold a baby and really just be fine with that, and was so excited, actually, that she could do that and was no longer troubled by that. So that's how embedded, when you're talking about fear, that's how embedded and intricate it can be. It's like, looking at a piece of fabric and on the outside looking and saying, well, I don't know, these threads all seem to be running the way they should be. But then, like, if you were to take apart that piece of fabric, you'd really get to see that, no, those 4 threads are running the opposite way, or whatever. You'd get to really kind of take a look and see what the underlying issue is. EMDR, even though it stands for eye movement desensitization reprocessing, it really has to do with bilateral stimulation of the brain. Big words. And when we tell you what it is, you probably think it's crazy that it could be so effective. But bear in mind, there is so little knowledge about our brain, really. But so, like, I have a set of headphones that has sound that alternates back and forth from one ear to the other. That then stimulates each side of the brain, bilateral stimulation alternately. I have another device called tactile pulsars. It's 2 plastic devices. You hold one in each hand and they vibrate back and forth. And anyways, what that does is that starts the brain to process information. And sometimes people will have memories that come up, but I've even done EMDR with people and they see colors or they don't see anything. They just get body sensations. But yeah, it's not a talk therapy modality, so it's ideal for people that have a hard time talking about things because you do very little, if any, talking with people. And they can still, the brain is doing all the work, so they're still going to process the information. And that's what I love about EMDR is it's the person's brain is healing themselves. I'm just, the vessel in terms of providing the opportunity and the machine. And then later we put it together, using my expertise. But the brain is actually doing the healing work. And so that's just awesome. Who would you add to that, Evangeline? Anything about EMDR that you've seen or that has struck you?
Well, just that when we have something traumatic happen, that it gets locked in our nervous system. And like you mentioned earlier, we start making these associations. So we lock in all, the pictures that we see, any sounds we hear, thoughts, any sensations we have, those get kind of locked in our nervous system as well. So those become triggers for us. So we hear a sound that reminds us of that incident, whether it be a car accident or some abuse or whatever the incident is that was traumatic to us. When we have any kind of stimuli that reminds us of that incident, we get triggered, and we then feel like we're back in that same experience, and we don't realize that, no, we're here in the present and we're not in the past anymore, but to us, we're very much in that same traumatic experience. And so with the dual attention stimulation, it's really able to unlock that trauma, and in a way that talk therapy just can't do all the time. So,
right, or certainly not as fast. I mean, they've done brain studies and scanning and things, and there's positive changes in the brain even with talk therapy. But for whatever reason, the EMDR really works quickly. One of the things I think we can all relate to is that when a person's talking about something that they're fearful of, I mean, it looks like they're in the moment, right? We see people that are anxious in the moment as if it were happening. Some level of anxiety. It may not be the same level of anxiety they felt, depending on the event that they're talking about, right? But we see them in that state of fear.
Right.
And so that's interesting, and it just really makes you, want to help the person get past where they're at. I mean, I have to tell you, I absolutely love what I do for a living, and because I have people say, I couldn't do your job, like I would never want to do your job, and I'm like, I love my job, and one of the reasons is because we do see, and Tom and Evangeline, you can speak for yourself, but I bet it's the same, is that we do see a lot of progress. It would be depressing. My job would be absolutely depressing if I did not see people get better. But the opposite is true, as I see people improve anywhere from a little to dramatically. And so that just really makes everything all worthwhile, and the job of a counselor is to walk with that person through their journey and their process to get from point A to point B. And I often tell people, because I've had a lot of counseling done myself and a lot of energy work and all kinds of things that I've gone through to work on my own issues, and I always tell people, I wouldn't be able to lead people where I myself have not gone. So what would be, I guess that's one of the things I want to hear from you and Tom, is just like a minor example, even like of a fear that you've encountered and how you've worked through it yourselves.
I'll speak of something that Tom mentioned was, the fear of kind of society right now, the shootings that do happen. There's some scary people out there. That is something that has been, that I fear, and, I see it in the media, I see it on the news, and so that does cause anxiety for me. And I have to kind of talk myself down from that, and I look at the facts. I'm like, okay, what, like Tom says, does this happen to everybody? People walk out of their door every day. Everybody doesn't get mugged, but when I get really fearful,
which is good.
I'm thinking, oh my gosh, it's going to happen to me. It's going to happen to my family. It's got to be us. And, I just remind myself of the facts. I'm being safe. I'm not going into any dangerous area. So I'm protecting myself. I'm being alert. I'm being as safe as I can be. And just reminding myself of the fact that, most of what we fear doesn't ever happen to us.
Right.
So I have to remind myself of that as well.
That's true. Tom, what about yourself?
Well, there was a big fear for me in change, because I'd been in law enforcement for almost 15 years. That's what I'd done for most of my life, adult life, and I changed into being, I had my degree in counseling and therapy, and I had my master's and everything. I was looking to make the change into becoming a therapist. And so I, had multiple job offers to go back to law enforcement. I had different different avenues I could follow, but it was the fear of going to the unknown. And I'd always wanted to do the therapy, go to do counseling, and work in the mental health profession. But it was a giant leap and jump from being the law enforcement and everything I knew for so long to jumping over to the therapy side. But it's the thing that I had driven for and always wanted to do, is to go to help people in the mental health field. And so even though it's what I always wanted, what I had, worked for, had got my degrees in and wanted to do for the rest of my life after I left law enforcement, there's still a big jump in not going back to what I knew in law enforcement with the job offers I had. Is like, okay, this is what you've been planning for. Talking with the wife, it's like, yeah, this is what you want to do. Go do what you want to do. Leave the comfort zone. That was a huge, there's that fear of failure, fear of the unknown, and just moving on to that next part of my life. There's a huge amount of anxiousness and fear to overcome to try to get to that point to change career paths.
Right. And so you just had to do it, right? Just kind of take that leap. And I mean, I'm sure you did lots of thinking about it, but you kind of just had to do it to write it out.
Yeah, and it was a lot of irrational fears, because this is what I've done my whole life towards going to. This is what I wanted to do after law enforcement. This is what my focus had been, is to be, a mental health professional and help people through therapy and counseling. And it's what my dream had been. But it was, just taking that step and trying to find excuses not to take that step was, trying to overcome that, and so having to overcome that fear and anxiety. And still, I still have a couple, there's still job offers out there. People call and I'm like, no, I'm doing this. So there's still, you're going forward in this direction and get away from the other stuff, which is, always back in the back of the mind, just because it is.
Yeah, it is. Well, and one of the things too that you're kind of mentioning in there too is like you can dwell on something, and just kind of run in circles with it, with whatever it is that you're dwelling on that you're afraid of,
Exactly. I dwelled on it for months and months, trying to see if this is the right path I wanted to follow, the right way I wanted to go. And I knew it was the right path, but, it's the, irrational fear, the, self-talk, the, well, you can't do that. You know this forever. You're good at this. Don't do that. And, I had to overcome all that to be, to move forward with my life and my career field.
Right. And people sabotage themselves a lot when they're fearful. So, they don't even do it consciously. So one example might be somebody who just, that perpetual student that stays in school and gets 5 degrees, because they're afraid to graduate, and then all that comes with that, because, then they have to go out and find a career and, establish themselves. And so, but they'll give themselves the excuse that, well, I just like school. I just really like learning. And maybe they do, but it's worthwhile to look at, well, maybe what's at the root of that is that they're afraid. They have this fear going on. Some of the conditions that we see people for include generalized anxiety, like Evangeline mentioned. And Evangeline, just mention again what generalized anxiety is.
It's worrying about nothing in particular. There's not one focus to your worry. It's just worrying about everything.
And then we see people for social phobias and social anxiety. I think that is one that a lot of people have, against to some degree. I always say that I think because people have anxiety and nervousness around being in groups of people, that I think that's why a lot of times group activities involve alcohol, because I think that alcohol tends to make people feel more comfortable socially. But we do see people for social anxiety and social phobias, specific phobias, even like fear of flying, fear of bugs, fear of driving, OCD, obsessive compulsive disorder, where a person just has repetitious thoughts and images about something that they're afraid of. So they might be afraid of their house catching fire and obsess about that. And in order to alleviate that thinking, they have to follow through with a compulsive behavior like checking that iron and checking, unplugging all the appliances in the house. And, they have to go through that ritual in order to alleviate that anxiety. So those are some of the fear states or fear conditions that we see people for counseling for. Some of the treatments, we talked about cognitive behavioral therapy and talked a little bit about what that is. Just to go a little bit more into detail, that involves thought substitution and thought stopping. So I always tell clients to have a menu of options, because what works in this moment is maybe won't work tomorrow when you try it. So I suggest to people that when they're doing well, to think of options that they're going to try, so when they're not doing well, they already have some things in mind. So with cognitive behavioral therapy, like, you can literally tell yourself in your mind to stop thinking the things that you're thinking. So if you're running these thoughts over and over in your mind about why you should be afraid to leave your house, to literally tell yourself, just stop, stop thinking like that. Again, sometimes that's going to work. Sometimes that's not going to work. Another cognitive behavioral technique would be thought substitution. So instead of thinking, oh my gosh, I can't leave my house, I'm going to die, is when the person's doing well, to think of some thoughts you could substitute in place of that fearful thinking that goes on. So things like, I'm safe, nothing's going to hurt me, my car's in good running order. I mean, whatever thoughts that are going to help, that will at least be neutral. Because sometimes people say, well, I can't think anything positive when I'm in that state of mind. I can't, One of the other things is distraction. I recommend that to people a lot, to just distract yourself, change the station literally, or go for a walk to interrupt that thought pattern that has you in a fearful state. Those would be two examples. EMDR, like we mentioned, I would, of course, highly recommend to try that. And people are so desperate when they come in for counseling the first time, that they're willing to try anything. So a lot of people will try EMDR even though they think, I'm not really sure this is going to help me. And then after they experience it, like, I have people that come to see me just for EMDR, because you have to be specially trained to do EMDR. You have to go for special training and get certified. So not just anybody can practice it. And I have some people that come to me, and Evangeline also as well, specifically for EMDR. There's also exposure therapy, which involves like making a list of the different things that a person is fearful of that lead up to like the main fear. So like if a person's main fear is flying, the list would involve things that are triggering, all the way up to flying. So it might be getting their suitcase ready the night before to leave, so on and so forth. And really going through each one and desensitizing, which means, working with the person using relaxation at the same time they think of that anxiety-provoking thought, until it no longer has an emotional impact at all. And then you go to the next anxiety-provoking thing, leading all the way up to the thought of actually flying. So that's exposure therapy. Then there's behavior modification, where you can just look at changing the fear response, maybe by using positive reinforcement. And an example is not really coming to my mind right at the moment, but it would be where, you could have the person reward themselves, for example, if they did something that was fearful to them. So maybe they're afraid to leave the house, and they're able to, the least anxiety provoking thing is for them to maybe go for a walk around the park. Well, one, that's positively reinforcing, because just getting, all those hormones going and the endorphins released, they're going to feel good from walking around the park. So that's a positive reinforcement itself, or they could reinforce themselves by maybe stopping at the end of their walk and reading a book, under the tree or whatever. That's behavior modification. And then talk therapy, of course, which, is always worthwhile because you have to be able to talk about this stuff first in order to, it's almost like, emptying your pockets out onto the table, right? And being able to look at, okay, what's there? The difference is that if you're able to come to therapy, then you're not doing that alone. And you also get objective opinions because it's difficult to think your way through things when you're the person involved. So earlier I had talked about, that I've been through lots of counseling and different other kinds of help too, like spiritual help and energy work and all kinds of stuff. And it's because when we're in it, it's hard to see clear. When a loved one is in pain, we're not the most objective people around, so I always recommend counseling or any kind of help like energy work, Reiki, different things to any of my family members or friends. It's those are things that I don't just talk the talk, like I walk the walk. Anything that I recommend to someone that they do, it's most of the time it's because I've done it and I found it to be of great help. There's no shame to be had in seeking help, and I think that even though it's difficult sometimes for a person to do that the first time, it does get easier after that. People get pretty good at knowing when they just need to go in to see someone to get a tune-up, that kind of thing. Anything you guys would add to what we've talked about, Tom or Evangeline?
Just that there's help available. Like you said, when you're in that moment and you feel like, nope, this is the way I feel, nothing's ever going to change that, I can't get better, there is help out there. There are therapies that work and, you can get relief, you can feel better. So don't give up in trying.
Tom?
I would like to say basically, fear is normal. Fear is, evolved into us. We have fear for a reason. It's when it goes to extremes that people need to realize there's irrational fear and they can't control it. They need help, and there's help out there for them. All fear is not bad, but you need to be able to identify when it becomes irrational and a hindrance to your well-being, and that there is help and there's ways to deal with the fear and there's ways of getting better so that you can go back to being a normal, what you would call normal for yourself, or a productive person, and back to your happy relationships.
And I'm glad you said that because, yes, fear is a normal and necessary reaction. In the research that I did, I was noticing that sometimes when the amygdala in the brain is damaged, that sometimes people don't have a fear response, and we need to have a fear response. There are, legitimate things in life that we need to be fearful of, and so that is absolutely true. I will say 2 of my therapists could not join us today because they have work obligations during the day. That would be Liz Cross and Jennifer Chavez, who are just as amazing as the 2 that I have on today that you're talking with. I have amazing people that work for me. And in addition to the clinicians that you've heard today and those that couldn't make it that work for me, I also have a first responder peer intervention team that are pretty dynamic and amazing themselves. And then I have a team of trauma professionals who have a great combination of traditional and holistic skills. You can visit my website and to see kind of a full array of the different things that we have to offer. You would go to Odyssey, and that's spelled ODYSSEY hyphen counseling, COUNSELING.com. Resilience Integrative, that's RESILIENCE hyphen INTEGRATIVE.com. And then, of course, the newer website is remotely-unique. Or visit our Facebook page, and please like us when you do so. This show now is on Stitcher.com, and it's available on iTunes under the podcast section. You can search for Remotely Unique and subscribe to listen to the show every week or download past episodes. We're also, again, available on Stitcher.com for iPhone, Android, and other devices. Next week, I'll be starting a series. My next series will be on creating healthy and happy workplace environments. I'm going to have Julia Bain, who is the head of employee health for the city of Albuquerque, as my guest next Monday, talking about how to be a good supervisor in the work environment, because that's where it all starts, right? Is with the supervisor. Join me next Monday, 12 o'clock to 1 o'clock Pacific Standard Time. And thank you so much, Evangeline and Tom, for joining me today. And thank you to all our listeners. You all have a great week, and we'll see you next Monday.
Thank you. Bye.
You're listening to Remotely Unique with Mary Baca, only on LA Talk Radio.